All right, guys, welcome back to Underground Science. And in this video, we're going to be talking about pancreatic amyloidosis in type 2 diabetes mellitus. Okay, so let's go and get started. So far, we've talked about senile cardiac amyloidosis and we've talked about familial amyloid cardiomyopathy. Okay, so those are all relating to amyloid deposits in certain tissues. Okay, in pancreatic amyloidosis and type 2 diabetes mellitus, we have amylin deposits. Okay, so first of all, let's just review basic physiology for insulin production, right? So we already have a video on this, but what happens, right, in a simple explanation is that if you have your pancreas, inside your pancreas, you have your islets of Langerhans, and you have your and then you have your beta cells, right? So let's say this is a beta cell inside your pancreas. Now the beta cell, right, it detects high blood glucose, right? So in response to high blood glucose, so if you have blood, high blood glucose, in response to that, your beta cells secrete insulin. Okay, you have insulin secretion, which then goes into your, obviously gets secreted into your bloodstream, then goes to your cells, like your fat and muscle cells, for example, and leads and then takes the glucose in your blood and shuttles it inside, right? So then the insulin secretion leads to normal blood glucose levels. Okay, so you have high blood, let's say you eat a carbohydrate-rich meal, right? Then you have an increase in blood glucose. That increase in blood glucose, your beta cells detect and release insulin. And then the insulin goes and binds to your fat and muscle cells, for example, and it helps shuttle the glucose inside it, leading to a decrease in your blood glucose levels to a normal level, right? Because as we know, high blood glucose levels over time, as seen in diabetes mellitus, is not good for your any organ system. Okay, so that's the basic function of the beta cell. Is its main job is to secrete insulin to lower your blood glucose levels when you increase it after a meal. Okay, but the thing is with insulin secretion, so every time you secrete insulin, your beta cells also secrete a protein called amylin. All right, so you also secrete a protein called amylin. So every time your beta cell secretes insulin, you also secrete amylin. All right. And normally, right, normally what happens is that the amylin is actually soluble in your blood. But what happens in type 2 diabetes mellitus is that you're secreting way too much insulin. Okay. Why does this happen? Because remember, you have chronic hyperglycemia in type 2 diabetes mellitus. You have insulin resistance, I should say. So that means your cells aren't responding to insulin as well, which means your blood glucose levels remain high, and those increased your chronic hyperglycememia, right, keeps on going back to your beta cells and stimulating it over and over because glucose is not able to enter your cells because your cells are insulin resistant. So your beta cells start secreting a bunch of insulin, all right? And soon, of course, your beta cells tire out. But in diabetes mellitus, where your beta cells start to secrete a bunch of insulin in high amounts. And remember, every time you secrete insulin, every time the beta cells secrete insulin, you secrete amylin. So then you also secrete a bunch of amylin, right? Now, normally, amylin is soluble, but if you produce way too much amylin, what can happen is, again, as we know, what is amyloid? It's misfolded proteins. Okay, so if we secrete too much amylin, eventually all this amylin can misfold and then aggregate, right? And aggregate, like, and where would these amylin proteins aggregate? It would aggregate in around your beta cells of your pancreas. So if we're secreting all this amylin, right, all the amylin can start to actually misfold. Okay, so you're going to have misfolded amylin proteins that can deposit as amyloid fibrils. All right. Now, where would these amyloid fibrils deposit? Around your beta cells, around beta cells of pancreas. As we know, amyloid damages your cells. It's not good for your cells. If it deposits around your cells, it can lead to cell damage. So if it deposits around your beta cells of the pancreas, around the beta cells of the pancreas, it can lead to beta cell dysfunction and apoptosis. Okay, so if we have amyloid deposit, right? And what is this amyloid made up of? Misfolded amylin. All right. So amyloid deposit around beta cells of your pancreas. What can this lead to? Beta cell dysfunction and beta cell apoptosis. All right. So obviously this would be bad because you already type 2 diabetes mellitus patients already have high blood glucose levels, right? And insulin resistance. And over time, if you deposit amyloid, right, in the form of misfolded amylin around your beta cells, now you start destroying your beta cells, and overall you get beta cell dysfunction. Now, on top of the high blood glucose level, now you're not even producing that much insulin, which worsens your insulin deficiency and worsens your hyperglycemia. Okay, so that's basically the main point to keep in mind for pancreatic amyloidosis due to type 2 diabetes mellitus. All right, so that's it for this video. I hope this helped a little bit. I hope you guys learned a little bit, and I hope to see you guys in my future videos. Thanks for watching.